Hi, I'm Dr. Sara Baird, and I'm a new physician at Greenville Hospital Systems. I'm working at SteadmanHawkins Clinic of the Carolinas, and my clinic is based out of Spartanburg. I'm a physiatrist, and my specialty is called Physical Medicine and Rehabilitation. During medical school, I became very interested in neurology because of a personal problem. My sister was diagnosed with multiple sclerosis, and I became very interested in neurological diseases, but also had always enjoyed sports medicine and musculoskeletal medicine. And I learned about physiatry and realized that it was the nexus between the neurological disease and the musculoskeletal, and really liked that it focused on maximizing function in patients. So I was born in Augusta, Georgia, and grew up in a small town on the South Carolina side called North Augusta. I went to undergraduate at College of Charleston and stayed in Charleston for medical school at the Medical University of South Carolina. After that, I did my internship and residency at the University of Virginia in Charlottesville, Virginia. And it was in my first year in Charlottesville that I met my husband, Matt, who was also a resident there at the time. Matt moved away for a while and did a fellowship in Tucson, Arizona, and then came back to Virginia for my last year of residency. After that, we began looking for jobs and knew that we wanted to be closer to family. Matt being from Tennessee and myself from South Carolina, that this was a very easy choice for us. And once we found jobs that suited our interests at SteadmanHawkins and were offered the positions, we were very excited and glad to be back closer to home. So in my clinic, there's a lot of overlap with primary care sports physicians in that I see back and neck pain, arthritis management, the running community. But in addition to that, I offer several unique procedural skills. The first is electrodiagnostic testing, more commonly known as nerve studies or nerve conduction and EMGs, which is a good diagnostic tool for evaluating for different nerve entrapment syndromes, carpal tunnel syndrome, cubital tunnel syndrome at the elbow, nerve impingement at the neck or the low back, which is a fairly common problem. And I am the only physician within SteadmanHawkins Orthopedics that is providing those services. In addition, I do spinal injections for the lumbar spine, including epidural steroid injections and facet joint injections, sacroiliac joint injections, and a multitude of peripheral joint injections. I grew up playing softball and I was a cheerleader, and I was always a runner just socially and for recreation, and pursued that throughout college and even into med school and residency. I ran my first marathon in January of this year and have run several half marathons. So running is my primary interest, but I continue to play recreational softball and golf with my husband. I really like the setup at SteadmanHawkins, particularly in Spartanburg, and I think that's what makes this practice so unique. In our office, we have not only a sports orthopedist, but we also have primary care sports medicine, we have total joint, we have foot and ankle, and we have a great group of therapists working there. I really like the multidisciplinary approach, and it's great to have those open lines of communication between all the physicians, the therapists, and all the staff. If I were a patient going to see a doctor, I would want someone who really spends time with me, who sits down and listens to me and hears what I have to say, acknowledges that I'm concerned or in some cases scared, in pain, and really works to help me in the best way that they can. I also want someone who has undergone good training in their field and knows their specialty well and is very up to date with the literature and treats me as a family member.